This meta-synced ECG review will focus on case number 498 from ECG Wave-Maven. Copyright information is provided here. A middle-aged woman is admitted to the intensive care with mental status changes. ECG findings are most consistent with which one of the following syndromes? The answer: hemorrhagic stroke. The ECG with baseline artifact shows borderline resting sinus tachycardia at a rate of about 100 beats per minute. Notable features include very prominent diffuse T-wave inversions, most apparent in the precordial leads, with marked ventricular repolarization prolongation with a QTC of about 520 milliseconds. In addition, there's a relatively tall R wave in lead V1, but without right axis deviation, peaked P waves, or T wave inversion in this lead, hence against RV overload states. Posterior MI is not excluded, but does not account for other findings. Diffuse ischemia due to imbalance in supply-demand mechanisms is also possible, as is Takotsubo cardiomyopathy. Borderline low limb lead voltage is present, a non-diagnostic finding. The constellation of major ECG findings here is fully consistent with the clinical scenario of a right pontine midbrain thalamic bleed. The mechanism of pronounced repolarization changes seen with so-called neurogenic T waves or CVA T wave pattern is not definitively established, but likely relates to autonomic activation and to direct myocardial injury from catecholamine stress response. This syndrome is most widely reported in hemorrhagic versus thrombotic or embolic type cerebrovascular events. The relationship between Takotsubo cardiomyopathy and neurogenic stress cardiomyopathy is an ongoing area of interest.